So we're into our session 17, our Fireside chat with, and I'd like to welcome to the stage Cameron Scadding, who is CEO and Managing Director of Source Certain. Thanks, Cameron. And this is in relation to how to achieve success while being ethical and legitimate. So I think the industry is needing that. So your stage is yours.
Thanks, Nathan. Just about there, folks. Last one. I'm going to speak for a couple of minutes and then I'll sit down and have a chat to Nathan, but I thought what I'd do is sort of ground the conversation a bit in terms of kind of how we, where we've come from and how we've got to here. I also want to reflect a bit on the 2016 to now sort of journey as an industry group. Also provide some recognition and thank you to Rosemary and to Peter. The leadership has been amazing and I want to try and touch on some of the changes we've seen, but also just quickly show you that some of that has actually been industry-led or at least industry-initiated. So, like I said, I'll do 5 minutes sort of so that we don't have another, big session of PowerPoint, but I'll do 5 minutes just sort of summing up kind of how we got to here. And how I've elected to do this is I've had the opportunity to speak at all of the A-Cannabis events, which I've been really grateful for. So I'm just going to just show you kind of the message across all of those years, but also then reflect on some of the really big changes that we've managed to get done, but also how important more broadly the trust of us as an industry body is and our relationship with all of our stakeholders. Oh, can I go back on? Okay, so as you can see, you'll see a wonderful evolution of my company's branding too. I sometimes wonder what we were thinking all those years ago, but anyway. But you'll see sort of the evolution. So there's a couple of messages here. One, I'm very consistent and probably some would argue a pest when it comes to some of these messages. And so you'll see some consistency in the messages of all these presentations. But if you go back to 2017, I must have done, I was involved in the Amendment 64 rules out of Colorado. I actually supported government in some of those from a supply chain perspective, and I came back after doing that work and then spent a fair bit of time early on in terms of, helping how we frame up the early stages of what this industry was going to look like. And you can see here, I'm a forensic investigator and analytical chemist by training, and so I'm a firm believer in the pathways that were set in terms of the medicine. And you can see the very first kind of title of that presentation, which was the red tape to frustrate or to sustain. I had a view then, and I still maintain this view, that if medical cannabis is going to sustain as a medicine, right, and actually, given all the various references to adult use over the last couple of days, I think it's even more important that it's able to do that. Some of that red tape, and I call it the edges of the road that were put in by the regulator, actually going to end up being really important, right? And so, at the time, I can promise you every room I walk into and said that it was all about patient access. And there's nothing wrong with that because that message was really important too, but what they did early ended up being quite important. The other message that we took out to the industry was how we behave as an industry group is really important. And the reason for that is that we want the door to open to the various stakeholders that we have, certainly early, in a way that is receptive so that we can be part of the ongoing change that ends up being needed. And so you sort of fast forward to that last of those sort of slides on that particular, on the right there, you can see what was the start of the Code of Conduct for the Medical Cannabis Industry Australia. So I was honoured to be able to be trusted with that piece of work with Rosemary and the rest of the industry to put that together. The whole principle of that, though, was how do we get industry aligned into a set of behaviours and values which then holds us together as we go through the various changes, but also gives us some fundamental credibility when we talk to our stakeholders. The other thing I'll note, right, who are the stakeholders? So at that stage, the regulator was fundamentally important, right? They were the most important from an industry perspective because it was all those changes that were made along the way that made the patient access thing possible. So what did that process look like? And there's a few people, I think, that were in that room during that particular session. And it was around that value setting, so it's really easy to get focused on what's competitive. And we've heard a lot about partnerships and collaboration and all those things over the last couple of days. There is some non-competitive stuff, how we behave as an industry, the minimum standards. Given all the regulatory frameworks that were in place, it actually wasn't hard to find those minimum standards anyway. But basically moulding them into a set of values, getting the industry, MCAA members to sign up to that, which then led to the code of conduct, which you can see there. Stepping through, so from the left there, we took the code to the conference, which is the one on the left-hand side of this slide. The middle one was then us taking the code and operationalising it via some collaborative webinar presentations that we did with the TGA. Our target being advertising. There was some clear education required around that space. And then, the one on the right, which was sort of the last of the A-Cannabis events, which was starting to reflect on, okay, how is the code working? Is it doing its job? But also, how do we start to think about how we, firstly, get more people into kind of the code, which is obviously more people into the industry body, and how do we continue to make sure that it's fit for purpose? The one thing I'll say here is the one on the presentation on the left-hand slide, which was A-Cannabis here in Melbourne, I think, I stood up on stage in the Melbourne event and it was a reasonably substantial call to action with respect to advertising. I think the guidelines were clear, and I think they still are clear, but it wasn't clear to me, and certainly on behalf of industry, my call to action was the regulator needs to do something here because, we can see what they expect, but there was no signals around enforcement. Obviously, we've seen that come to fruition. The other thing we made a really big deal about there was this fair playing field to make sure that local, certainly MCAA members that were investing in quality and being part of a code of conduct and doing all of this industry and capacity building work were then not unfairly competing with substandard product coming in from overseas. So, we call for action, and what we've got now is, and some of this stuff's already been talked about through the event, and Nathan and I will chat about it over the next 20 minutes, but we called for action. Like I said, it's not so much about, enforcement, but it's about making sure that the good guys have that fair playing field. But also, we'd heard the words from the regulators, so it's important then to see the action. And from an industry perspective, probably the most important thing here is, where does the code play? And I'm pleased to say that none of those advertising breaches were MCAA members. But also, the code provides us with a way to engage with the regulator on these issues, but also with other members to make sure that they understand, what the requirements are and how they stay inside the rules. I'm going to leave it there, and I'll hand it over to Nathan from a...
Come and grab one of those microphones that I grabbed, and let's have a bit of a chat. So in terms of, you mentioned, you've done a bit of work overseas, and that was in relation to cannabis as well. Mm-hmm. And the learnings from overseas and seeing how the industry's developed here, what have we done right, and what could have we done differently?
Yeah, so it's interesting, right? So my experience from a Colorado perspective, and then obviously my Canadian experience was certainly in the adult use space. So, I was used as a resource around, how do you make sure that the illicit supply chains are not intersecting with licit ones, and how do you make sure from a public policy perspective, if you're going down these paths, how do you protect, the public policy against all those other, what can be very noisy but also very impactful, quite criminal industries. And so from an organised crime perspective, it was how do we keep them out? To be honest, they haven't done that, right? They the levers that they had available to them haven't achieved that. What I learnt from that was not so much about, those specific experiences. I can talk about those if people are interested, but what I learnt about it was how important the specificity around the public policy is. And so if we're going to have a medical cannabis industry, it needs to be medical. which means I've always subscribed to I actually think it's being regulated in the right spot. I don't advocate for a separate agency. I advocate for the fact that if we want it to be a medicine, that's what we should do, and we should go through the process. So I actually think we did do the right thing there. I think one of the challenges is that you can get the public policy part kind of to a point, but the industry has to be sophisticated and mature enough to then kind of take the next step, which might be with the regulator, but there wasn't an industry, Nathan. So those more sophisticated conversations happen now, right? And so, which is one of the reasons why we put so much effort into the code was, how do we all be in the room together and know that everybody's, heading in the same general direction, and there's a general level of trust around the fact that it's all about the patient, right? And we all agree on that, but we know that there's some frameworks that we need to operate within.
So industries, you'd say, have got its training wheels off now?
I don't. It's still I know it's not going fast enough for some, but it's still going at a pace, right? I mean, I think most people have reflected on this stage that the regulatory change has been reasonably quick, right? It was profound first, it became legalised, and then there's been quite a lot of changes to address the problems. I think really good industry bodies never take the training wheels off. They're always trying to make sure that they've got their eye out. There's plenty of examples in other sectors where they haven't stayed in front of those and those emerging issues, and they end up with black eyes. And so I don't think that the time's right to take the training wheels off. I think it's more about how do we build I really liked the research presentations over the last couple of days, because they're quite fundamental building blocks to a diverse industry that is mature and resilient.
Legitimate?
And legitimate. I mean, the fact that this room fills up, and the fact that you can put 10 early career researchers on it, I mean, they're great markers of maturity. And what you've got to do is have the industry, pointed in the direction where, one, they leverage that, but also there's a will for new talent to come into this industry. And so I think it's too early for us to be starting to think about that, but it's profoundly better than when we started. So.
I agree. It's the professionalism and like you said, taking the high road. I think when we first caught up around, pardon the pun, taking the high road for the greater good of the industry. So in terms of writing the code in conjunction with MCIA, how did you go about that and approach that from your point?
Yeah, so I think the principles were relatively simple, right? What we wanted to do is get to a position where we had an alignment with respect to industry and the values by which it was willing to operate, but we also didn't want to add, requirements that this is a very well regulated space, right? But the code presented us an opportunity to take all the different obligations, distill it down into, out of the black letter stuff and into, this is why we actually do this, right? So the quality standards, the ODC rules, they are all there for a particular purpose. And what the code enabled us to do is to contextualise these, right, into if we're going to be trusted as an industry, right, and that trust is actually really important. I talked about the regulator, but they're not the only stakeholder. It's the medical professionals. It's the new talent, which I kind of put in a bucket together, right? The new talent coming in. All of those are critically important to the success of the industry. And so what the code did is it enabled us to contextualise it, but it also gives us a start to how we deal with any of the issues, ranging from whether it's a quality issue, an advertising one, whether it relates to regulation or reform of regulation, it gives us a strong starting point for that conversation. And so the power of it is not the document. The power of it is the fact that the members all got in a room, and I tortured them with workshops. I tortured them with workshops and little sticky notes, and we came up with something that is now represented in the code, and we routinely fall back on it. So.
And that do you see codes like that you've probably written elsewhere for others, and they're a constant evolution?
They are. So the relationship between industries or stakeholders and their other stakeholders, right? Their customers, their whatever they may be. The requirement for trust in those relationships is so important to the resilience of whether it be industry or a company or whatever, that you're absolutely right. They do change, and this particular industry and the work we did here has resulted in a pretty stable version, and that's partly because of the fact that the industry is still maturing, and so therefore, you know, we're just trying to get people on the right track, as opposed to, you know, when you get into some of these other bigger industries, which I've certainly talked to, there are stakeholders pushing boundaries, which you also want sometimes too, because that's where the innovation comes from. And so you're absolutely right, they do evolve. It evolves because of the fact that there is a need for the industry to evolve because of the fact that their stakeholders have different expectations, or there are other kind of threats, you know, in terms of other industries, competitive threats or whatever, but either way, there's a need for it to evolve.
Yeah, interesting. And firstly, throwing it out to anyone in the audience, please feel free to put your hand up. It's not just me taking all the questions. It is an interactive session. Pop them into the app as well. That's probably in relation to changes where you see what changes could occur that you, like, we're trying to crystal ball this. Like, I'm always about, like, what's around the corner. Like, what do you see that's around the corner for our industry?
So, if I look at the industry, it's not so much from a code perspective, but I look at the industry as a whole, and having been involved since sort of the beginning, I think we're probably heading into a point where there's a stability around the rules, right? I don't think the companies have done what I guess the intention of the regulation was, which, you know, I summed up in 2016-17 as a race to registration. I don't think they've done that, right? And you can't run the clock back, so that's not likely to happen. So I think there's going to be a stability in terms of some of those rules, and I think, you know, the biggest changes I think are likely to have been done. I think it's now going to be industry-based. So I think we heard a couple of references to consolidation, M&A, and I think the market itself will start to have its influence, which is also reasonably normal, right? Like all those other factors that can impact the success of a company, all those sort of need to settle right before those other more business-related drivers do come in. I have been interested in the level of discussion and reference to adult use over the last 2 days. That's obviously not something that's going to happen in the next couple of years, or year, certainly. But I think there is a clear signal to industry that, you know, for us to maintain our medical industry, we have to make sure we're clearly differentiated from that. I do agree with some of the other speakers that it is possible to do, but it is a deliberate thing, right? It has to be something that industry decides to do, and, you know, codes of conduct, the rules, all those sorts of things are part of that.
You'll be busy again.
Yes.
And Source Certain, you know, it takes a lot to go and found a business, build it from scratch. Like, what made you drive and build that? Like, what was the deciding factor for you for Source Certain?
Well, it has absolutely nothing to do with cannabis.
No, this is more for everyone.
Absolutely nothing. So, I have a vision or a mission that the products that we consume, or the stuff that we buy, right, and the decisions we make around those purchases can fundamentally change the way in which we treat the people and the planet, right? And so my first iteration of business was in 2006. Source Certain was 2016-17. And Source Certain is all about trusted, transparent supply chains, right? We have a technology that enables us to determine where something comes from. And so my mission is that, right? And how it intersects with cannabis is, you know, what does trusted look like? And there are plenty of examples, ag in particular, where we've misstepped, right? And we've lost the social license or freedom to operate around technology. And GM is a good example, and Rosemary can speak even more underwater about that than I can, right? GM is one of those, right? And so I've always been of the view there is just such a substantial opportunity for the mediation of transparency, around with technology, and the other way you do that is through regulation. And so the intersection for me was around how. What does regulatory-based transparency mean from a cannabis perspective? And obviously the first entrance to that was, which is my kind of niche expertise, is organised crime in supply chain, which of course is cannabis, right? So that's how it started, and that began just before Amendment 64. So.
Well, thank you for doing that on behalf of us. So, and any questions? What have we got? We do. Why do two national associations exist? Well, that's a good question.
Can I answer that?
That is to you. That's not to me. That's to you.
I reckon it's a better one for you. I think there'll always be, certainly in, I don't know the answer to the question, but let me not answer it.
I'll have a go after.
Yeah, I think, when it's new and you're making decisions around what an industry is going to stand for and how it's going to go, and I don't know if Peter's in the room because he would also be a better person to answer the question, but not everyone's going to agree, right? And I have spent since 2016 speaking in rooms where half the room didn't agree with me either. I advocated for, mostly because we had it, as opposed to trying to turn it off again, I advocated for cannabis to become a registered medicine, right? And I wanted a company to go and do that, right? That's what I wanted. I described it as you need to thread a needle from about 200 metres away, right? That's how I described it in 2017. I still think the needle's 200 metres away. But those fundamental differences, I think, in views as to where the industry should have started and where it needs to go drives those. And so I think underneath those are two quite different philosophies. I'll be honest, I think the one that is aligned to regulation with who are inside, the tent to create and drive change is going to be the one that sustains, and obviously we're supporting MCAA because of that. So.
And this is an interesting question. So if we do, and this goes to probably to Canberra, if we consider cannabis as a medicine, if doctors are able to prescribe seedlings or seeds for patients and grow their own, particularly to access stable products or acids, that's probably...
So, yeah, the relationship, because one of the points, I scribbled notes down throughout the week, right? We've used kind of the relationship of the manufacturers, industry manufacturers, regulators, but also then who are the industry's customers, who are their stakeholders, which are obviously pharmacists technically, and then you've got doctors, right, that are obviously doing the prescription. And so whilst I accept the premise that maybe there's something possible in there, the way we get the most uplift or impact from cannabis as a medicine is if it looks like, whether we agree with this or not, if it looks like all the other medicines, right? And so if there was a registered, and there are, like Epidiolex and Sativex, if there's a registered version of this medicine that could get onto our PBS, right, we wouldn't be having questions about doctors accessing it, right, because it'll be registered, it's on the PBS, and with that comes a whole heap of information which is in the format that they like to see, which is just a mediation of transparency question, right, which then provides them with an opportunity to engage and obviously prescribe. So from a medical perspective, I think my view is no is the answer to that question. I think I think you end up in...
Don't know if a pharmacy would want to turn into a nursery.
Yeah.
That's probably my...
I think that underneath, I'm not sure, is it Natalie? Underneath the question is a broader question around, what's the role of cannabis in society, I think, but anyway, yeah.
There's a question, there's a hand up there. Yep. I see that. We'll get a microphone to you, sir. If you can yell it out, feel free to.
Okay. You just referred to the GM.
Yep.
If you want to keep it as a medicine, and you look at pharmaceutical companies, they use GM.
They do.
They use GM all the time.
Yep.
Yet because of DuPont and agriculture now we're faced with this in the medicinal cannabis industry. It's a plant-produced product. and yet there's a reluctance to go GM if we're going to. So where do you see that sort of heading? Because pharmaceutical companies use GM all the time.
Yeah, I think...
Do you want to just elaborate on what GM is for
So,
all of them?
and I think it's important, right, to just also note that genetically modified and and edited are different, right? So let me approach it from a social license, because there are probably plenty of plant scientists that can answer the technical parts of it. But let me approach it from a social license perspective. Agriculture misstepped fundamentally with respect to how it, or the disdain, frankly, that it held consumers and the general public with respect to this. It happened a couple of different ways. One of them was, there was a whole heap of industry-based or corporate-based activities. Leave it alone. Most people can look that up. The other part too is a lack of motivation or will to actually educate the public, right? And we've just come out of a period too where I think we've kind of seen another example of that with the pandemic, which is, I think we treat the general public, from a scientist's perspective, we tend to be snobby when it comes to intellectual arguments and intellectual conversations with the public, and therefore we tend to not have them, right? And that's what, I mean, that's fundamentally the issue with respect to, we didn't take them along, right? We didn't explain it, we didn't do any of those things. CRISPR, gene editing, the new versions of those technologies present wonderful opportunities to approach the opportunity with discipline, which there are fantastic models out there to follow, which enable engagement, education, and again, it's a very simple transparency model whereby you have to find a way to get information to them to change that motivation bias, and it's not easy because unfortunately, just like cannabis actually, frankly too, we do suffer a bit of confirmation bias when it comes to these types of issues now, and I encourage. And I remember I stood up, I did a keynote at an ag tech conference a couple of years ago, and I come from a wheat and sheep farm in WA, and I always avoided the roundup conversation because it's like politics at Christmas time. It's like, you know, or religion at Christmas time. It's like, oh no, you just don't even bother, right? But I got off the stage and a guy came up to me and said, no, you have a platform. You should be using it to educate. And so from that point onwards, I've never shied away from the GM question. I've never shied away from the roundup question. But most importantly, the young, sort of emerging scientists, communication, the ability to communicate science and technically is so fundamentally important for the future. And so I encourage all of the scientists to get in the game, actually have conversations and talk to the general public and get amongst it.
I totally agree. And you lead into something that I was on the top of my head around, and we spoke about this earlier, which was Delta 9.
Yes, or Delta 8.
Delta 8, sorry.
Yes.
I was just going to say Delta 8. In relation to that, what is the US doing, and why are they doing that?
I don't know the answer to the why. Well, the why is because they've got so much supply, haven't they, of CBD, that it's got to find a home. Their regulatory system is so fragmented and, frankly, quite unsophisticated that it's unable to clearly deal with it, and that's come about from a patchwork approach to cannabis regulation, and then on top of it, a really messy hemp bill. Right, and so it's resulted in a lack of clarity. We obviously had the Delta 8 issue here, emerge here. It raised some really big questions for me as to how something like that gets into this country, right? And I've had lots of debates. Melinda, who's in the room here from my team, her and I have kind of talked about this at length. You know, there's a whole heap of things that had to happen that enabled a product to get out of there into here. You know, was it an ag product? Was it a pharmaceutical product? Was it a drug? Was it scheduled? All of these really quite technical. Was it research? Yeah, that's right. And then you've got groups here advocating for it. And then, you know, I was asked a question about, you know, how do we handle it? And, you know, the code provides us with a pretty good way, right? And that's that, does the doctor have enough information to make an informed judgment? They're the most important stakeholder here, right? And the answer is no, they don't, right? There isn't enough data. And it's not done well enough, and therefore, from an intent perspective of what we set up with the code, does it fit? No, it doesn't. The rules are pretty clear, and so therefore, that's kind of how we move forward. It's not to say that there's not a role for Delta 8, but you can't, reasonably in a grey and opaque way say that it's just the same as Delta 9. It's just THC, because that's not the case, right? Because there's how many hundred of the other ones? Do we just have the same thing for those two? So.
Well, so I think it was from the first day. It was called the soup. That was
that's right. That's right. You can't have it both ways, right?
And that probably goes to we do have, like, in the global sense of where you see regulations. Is Australia a bit of a unicorn in the fact that we do have it registered? It's federally done. The US doesn't. We don't play in ancillary markets. It is prescribed to the dose by the doctor. Yeah. So for clinical research, and if you're out there as a company supplying to Australia, is Australia the fertile ground for research and making this more legitimate as a medicine?
Yeah, it is, I think, because I think about it from the point of view of what does industry want from its regulators, right? And I think engagement and predictability, right? And so we have both of those. We have engagement, we have predictability, and we have stability. As soon as you get to that, and then a critical mass around industry, which, look here, right, we've got to there, you end up with a fertile ground, right, for being the absolute leaders with respect to those research outcomes. But I kind of come back to where I started in 2017. I don't think the intent was for that to be the outcome of those earlier rules. I think the intent was to have registered THC medicine, right? I think, what's happened is actually more broader than that, and to your point, research and, the development of products, and the panel that was up here before was excellent, right? Just shows you how good we actually are at that.
No one was talking about that when we first started talking cannabis. There was no research. There was no.
And there were people amongst the industry with some of those skills, but now there's a critical mass of those people, and you can get to people and ask these questions now and actually get to products. So.
And that's us. We're over time. I'd like to everyone to thank Cameron Scadding for his time.